Hi there, this is Dr. John from the Florida Center for Hormones and Wellness. And I want to talk a little bit about bleeding in the postmenopausal woman that may be on biologically identical hormone therapy. This is an issue that comes up from time to time. Unfortunately, it can be very disconcerting to the patients, but in reality, as long as it's related to the hormone therapy, it is a very benign situation that can be controlled very easily in most cases. So let's take a look at a scenario. You're 53 years old, you haven't had a cycle in say 3 years, and you've gone to the doctor for the first time to be started on hormone therapy. Well, oftentimes at that point, the hormone therapy will consist of a combination of estrogen, actually estradiol, and progesterone. And it's very important for that combination and that balance between the estrogen and the progesterone to be balanced, because it's that balance that stabilizes the uterine lining. And the uterine lining is where the issue of bleeding can arise. Sometimes in some women that are sensitive to estradiol, that uterine lining can proliferate and get a little bit thicker than what we would like to see it in the menopausal state. We do want it a little bit thicker than it is without hormones, but we don't want it so thick that it will bleed. So let's take a look at the normal situation. In the normal woman that's cycling every month, you have the estradiol builds up during the course of the month, and then it trails off, and during the course of the buildup of the estradiol, the uterine lining will get a little bit thicker. And then at the end of the month, when the estradiol and the progesterone levels fall, the uterine lining sheds and it comes out as a menstrual cycle. Well, what we want in the menopausal state when we're using hormones is we want to build that lining up just a little bit, a couple of millimeters with the estradiol, and we want that progesterone to keep it in balance. So it's just a little bit thicker, but not so thick that it comes out every month. In some instances, that lining may get ahead of what we want. That is, the estradiol-progesterone balance may not be just right, and we may see some spotting, and in some cases, some rather vigorous bleeding. In those cases, the key is to rebalance the progesterone. This can be done in a number of different ways. It can be done by doubling your doubling your progesterone dose, or giving a shot of progesterone in the office in order to give an exceptionally high level of progesterone to then stabilize that lining so that the bleeding will stop. So we go ahead and we try to rebalance that progesterone estradiol balance, get that bleeding to stop, and we usually can accomplish this in about 4 to 6 weeks. If we don't accomplish it within that period of time, usually what we'll do is we will go on to get a uterine ultrasound. That will give us the exact thickness of the uterine lining and allow us to make a determination of whether or not this is just strictly related to the institution of the biologically identical hormone therapy, or if there is potentially another problem, because sometimes that bleeding may be a good indicator of something that's a little bit more serious that needs to be looked at. Now, I don't want to alarm anybody or scare anybody that may be bleeding. That's often very rare, but the things that we can find are sometimes polyps, endometriosis, or sometimes we can find some more serious issues with the endometrial lining or the uterine lining. But it's important in those cases to identify those and then go on and get a proper consultation with a GYN and make sure that we're getting things taken care of. So again, in summary, what I want to bring up is that about 1 in 10 or 1 in 20 women who go on biologically identical hormone therapy will experience an episode of uterine bleeding that they don't expect. While that's not something that we want to see, it's not something that's often very serious or very concerning, but there is a very specific protocol that we want to undertake that is first making sure that our progesterone estradiol balance is right. If that doesn't prove to be the case, then we want to get a uterine ultrasound and make sure that the lining is not too thick. And if we find anything unusual on the uterine ultrasound, then we want to get appropriate consultation with a GYN. So uterine bleeding can occur, but there's a very specific way to deal with it. I know how to do that. All you need to do is call the office and let us know, and then we can put the protocols in place. So this is Dr. John from the Florida Center for Hormones and Wellness. A little chat about uterine bleeding after the institution of hormone therapy.